就是可以讲到 say us 不容易。
Good morning, great people.
Good morning.
Morning.
那之后问你，我就有我呢。
Okay, thanks.
Slow me. Because at the same time, let Baba pay the same. While I'm with a more to how that moon. Never down all that. Now the 100, when they always are doing it.
Yeah, good morning.
On dying.
Is it only me that is not hearing?
Yes, I'm not hearing.
I'm not hearing any.
I'm not hearing clearly.
The lecturer is yet to join the class.
Okay. Is in the class rep? Good morning.
No, it's not class rep, it's Desmond.
Okay, Desmond, how are you doing?
I'm good, well done.
Thank you.
Good morning. Techno Pop 9.
Yeah, I don't know what's happening with my this thing now. I just want to correct it. It's Silas on
Please,
my.
who is Techno Pop 9?
It's Silas. I don't know what is. I'm trying to rectify it. Hello. Hello.
Okay, you usually you change your name. You change your name
No.
before you log to the lecture. That's how it is done.
Okay, I should off it and log it back.
Yes. When you are logging in, you will still wear the access of your name. So change the name to your full name and then log back. It makes
Okay.
more sense. So that we'll know who is there and for attendance.
Okay, let me go back there.
I say join audio.
Hello?
Morning,
Hello?
man. Good morning,
Good
man.
morning. Good morning. How are
Yes,
you doing?
we are good, man.
All right. Okay, sorry for coming late. I had
It's
some
okay.
technical issues and then with the weather as well, the rains and all of those. But we are here. Thank God we are here. Yeah.
Yeah.
So, can you see what I'm sharing?
Yes, we can see your slide, man.
Okay, but you cannot view me. You cannot
Yeah,
see
we can
me?
view you as well. We can see you as well, man.
Okay, you can see
You're
me.
sitting, yes,
Oh.
you're sitting behind the window.
Okay, that's fine then. So, let me see. So, can I also see all of you? Hello?
Okay.
Yes. So I can see some of you. Can you put on the video that we can see each other? Okay. I am all right. It's okay. So can we make a quick introduction? Can we make a quick introduction?
Good morning, ma'am. Samuel Omonia, based in Jos here, one of your students.
Okay. Okay, that's fine. Yes, the next person.
Good morning, ma'am. My name is Chairman John Ode. I base in Makurdi, Benue State.
Okay. Okay, that's fine. The next person.
Good morning, ma'am.
Good morning.
My name is Ogugano, based in Makurdi.
Okay. Yes, the next person. Let's
My name
snappy.
I'm based in Makurdi.
Okay. Yes, the next person.
Good morning, ma'am.
Good morning, ma'am.
This is Gwaka Gemga, based in Abuja.
Okay, that's fine.
Good morning, ma.
Good morning, ma.
This is John, this is Makurdi.
Okay.
Good morning, ma.
Good morning, man. This is Gbamo Anastasia, based in Makurdi, North Bank.
Okay, that's fine.
Good
Yes,
morning, ma.
Yeah.
My name is Maria Madamu, based in Abuja.
Okay, yes.
Good morning, ma. My name is Nkenakola, so I'm based in Makurdi.
Okay.
Good morning,
Yeah,
ma'am.
Yeah.
This is Calvin Azande, based in Makurdi.
Okay. The next.
Good morning, ma'am.
Yes.
Jennifer Chekwa, based in Makurdi.
All right, that's good. Yeah. The next person.
Good morning, ma. This is Zula Kushaki, based in Zaire.
Okay, that's lovely.
Good morning, ma. This is Patience Omudu, based in Makurdi.
Okay, you're welcome.
Thank you, ma.
Yeah.
Good
Yes.
morning, ma.
Yeah.
This is Abu Monica Mimido, based in Makurdi.
Okay. Yes.
Morning, ma.
Yes.
This is Uti Kenneth Kwafan, based in Makurdi.
Okay. The next person. The next person.
Good morning, ma.
Yeah.
This is Busukuma, then based in Makurdi.
Okay. Yeah.
Good morning, ma.
Yes.
This is Medical Silas, based in Makurdi.
Okay. Yes, the next person.
Good morning, ma.
Yes.
Good morning, ma.
Yes, I'm listening.
It's your Averin, based in Makurdi.
Okay, you're welcome. Yeah.
Good morning, ma. Good morning,
Yes.
ma.
Good morning, dear. How are you?
Fine, ma.
Good
This is
morning.
Ajaka based in
Okay.
Makurdi.
You're welcome. The next person.
Good morning, ma. My name is Chiba Augustine. I live in Makurdi.
Okay, it's fine. So, can we just briefly stop and then we'll continue later? Your number is about 41 right now. So let us continue, and then we complete with the introduction later. Is that okay?
Yes.
Okay.
Yes, ma'am.
Okay,
ma'am.
that's fine. That's fine.
Psychopathology. Psychopathology.
Sharing. Can you see me? Can you see what I'm sharing? Okay,
Yes,
you can
ma'am.
see it.
Slide.
Okay, the slide is there.
There is reflection there.
Okay. Can you see it now?
Yes, ma'am.
The
Is there
window
still
is,
reflection?
the window is reflecting.
Okay, let me change my position.
Okay, ma'am.
Yeah.
Is it okay here?
Yes, 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 yes. It's
Okay, that's okay. So I am by name Dr. Dorothy A. Igbende, and I am a clinical psychologist. And today we're going to look at psychopathology. So first of all, maybe you have heard about the name psychopathology, or you have maybe used that word yourself. Maybe you were a psychology student sometime, and you are quite informed about that term, psychopathology. So let me ask, what is psychopathology? Can anyone tell us? Are you hearing me from there?
Yes, ma'am.
Hello?
Yes, ma'am.
Yes, ma'am, we can hear you.
Okay, yes. Yes, you can go on.
Let me try.
Yeah. Okay.
Psychopathology is the study of mental and social disorders.
Okay, mental and social disorders. Yeah, that's Teoakura Desmond Tefa answering. Is that?
Yes, ma'am.
Yeah. What other explanation can you give to the term? Another person?
Okay, ma, can I try?
Yes, you can.
When we talk about psychopath, we are looking at behaviors that are abnormal. So psychopathology should be the study of abnormal behavior or behavior that are mentally disordered.
Okay, that's very good of you. You have all tried. So here is what psychopathology is. Yeah. So it is generally referred to some maladaptive behavior, just like you have mentioned. And this maladaptive behavior can be in such a way that once something is maladaptive, it is not in the real form, isn't it? It is not normal. When something is maladaptive, we have adaptive and maladaptive behaviors. So psychopathology, usually when we hear about psychopathology, we are looking at, or everybody's mind is casted on maladaptive behavior. Those behaviors that are so stressful, that can cause distress, that can make you to misbehave and, behave in an abnormal manner. So when we talk about psychopathology, we're simply trying to look at issues of maladaptive behavior, issues of mental disorders, and issues of malfunctioning. Are you getting what I'm saying? Hello?
Yes, ma'am.
Yes,
Can
yes,
you
ma'am.
Yes,
Okay, it's fine. So basically it is a study because it is a field of study. So it is a study of mental disorders, emotional problems, maladaptive behaviors, and all of those. So is it a scientific study? Does it study maladaptive behavior scientifically, or how does it go about it? Now we are told it is a scientific a study of mental disorders. So when something is scientific, it means that it encompasses certain things like you have to go into research, you need to understand, you need to, try to use some test materials, you need to use assessment, you need to use a lot of things, and then you try to identify the causes and all of those systematically. When you do things systematically, then it is of course scientific. Now this study is done systematically, trying to know a lot of things about how behavior is malfunctioning. So it is to say that psychopathology is a scientific study of mental disorders, which encompasses symptoms, causes. It talks about diagnosis and also treatment that can help resolve the issue. So some look at the term psychopathology as meaning a pathology. So when we talk about pathology, what do we say? What do we mean? Or what are we looking at? When we talk about pathology, what are we looking at? It is a question to the class. When we talk about pathology, what actually are we trying to look at? Hello? Hello?
Study of mentalness.
Okay, when you say pathology, pathology talks about a disease.
The scientific study of.
Yeah, it talks about a disease. So it means that when you say psychopathology, it means psychological study of mental disorders. Is that okay?
Yes, ma'am.
Yes, ma'am.
Okay. It's like the network is tripping, huh?
It's checking seriously.
Oh, okay. But we can manage it, I think so.
Yeah.
Let us manage it. Let us manage it. Okay. So if we are talking about pathological disorders, like you can say mental disorders, and then you talk about malfunctioning, you talk about maladaptive behavior, you talk about a lot of issues that has to do with psychosis, which we'll give an example of schizophrenia and all of those. And then you have to also talk about distress. You have to talk about depression. You have to talk about those disorders. A lot of them, there are a lot of them. As you look at the DSM-5, you'll find a lot of them there. So, but we want to look at first, since we are talking about mental disorders, we say psychopathology is the study of mental disorders. And so what are these mental disorders? What are the mental disorders? Now we are trying to look at mental disorders as a syndrome or a disease that is clinically characterized with significant disturbances in an individual's cognitive functioning, in how the person behaves, and how this can be explained using psychological, biological, and developmental processes. So when we talk about mental disorders, simply we are looking at the syndrome characterized by clinically significant disturbances. We're trying to look at disturbances in individuals and how these disturbances affect this individual, how they reflect a dysfunction, how they affect these people biologically, psychologically, and developmentally. Now, there are some disorders that affect your psyche. There are some that affect your biological underpinnings. Now, all these disorders when they come up, they affect human functioning. Now, when you have a disorder that, hello? Hello? When you have when you have a disorder that is not giving you the room to perform as you used to be, of course, it has affected your mental functioning. Now we need to be mentally intact in order to do whatever we are supposed to do. Now, if we are unable to function properly as a result of any disturbance, then we have a dysfunction, or we are having some disorders. So and professionals are supposed to look into it so that they can make some corrections. And that is where the study explains that it looks at, it studies the causes, it studies the symptoms, it studies the diagnosis, it also looks at the treatment and also the prevention. So we have mental disorder here to enable you understand what psychopathology is trying to talk about. So of course, we know that mental disorder is associated with stress, a lot of distress, a lot of occupational malfunctioning, and all of those. Like I earlier said, when you have a dysfunction, when you have a disorder, mental disorder, upstairs you are completely cognitively unstable. And so because you are not able to think right, you are not able to do exactly what you are supposed to do as the behavior expected from you, then you find things difficult, even though you may partially know or may not even know how you are behaving at all, but people around could be able to give a testimony of how you are behaving. Let's look at an example. Let's look at an example of, let's say, patients who have severe illness condition, severe mental illness condition, who are basically in the hospital or who are receiving treatment in the hospital from time to time. Now you discover that when they are overtaken by these illnesses, it becomes very difficult for them to perform well in their workplaces. Are you listening?
Yes,
Okay.
Yes, ma'am.
So it becomes very difficult for them to operate in their workplaces. They have issues and all of those. I remember one time when a lady had a problem with, I think she was depressed also, something like that. I've forgotten particularly what happened, but she came to the mental health facility to receive attention. So what happened basically was that she was not able to perform in her workplace. And then the people that the manager wrote and gave her the permission to go to the hospital. So when she came to the hospital, she explained everything. But then what she did was she strictly wanted them not to reveal everything about her to the manager, that she may be sacked. So they communicated, they had to communicate the management in a tactical format since she pleaded. And so, but then the end of the whole thing, I'm not going to talk about the end, but then what I'm trying to bring to your notice is that she was not able to perform very well as a result of a mental condition. And so when the management noticed and gave her some permission to visit the hospital, it was identified that she has a mental problem. So when the specialists were talking to her, she made mention of what I'm saying, like that shouldn't inform the management that she may be discharged from the, she may be maybe given off, thrown off her duty, and so she may not be able to perform very well again, or even if she had recovered, she will find it difficult to stand the stigma. So that information was duly passed, and I only visited that place, so I am only bringing a little example to show how these illnesses can affect your workplaces, how these illnesses can make you feel stigmatized, all these illnesses can make you feel like the whole world is falling on you, that people are perceiving you in such a manner that you may not want to be perceived. So when you have dysfunctions, it affects entirely your whole being. It affects your whole being. And that is why we have hospitals and a lot of consultancy services around that can help people get well again, get back on their feet. So even those who are chronically or severely affected by mental illness, when they submit themselves for treatment and are given adequate treatment, they recover. And I tell you, it is not written on the forehead. You will not be able to know who has this or that until the person starts misbehaving, or until the person starts exhibiting some kind of behavior, some agitative kind of behavior. So let me give you another again. One time when I went for data collection in one of the hospitals, one of the psychiatric hospitals, there was this patient. He came to the hospital, not a patient, but he looked like not a patient at all. To me, when I saw him, I thought he was also part of those working in the hospital until it was revealed to me. But it was revealed to me because I'm a clinical psychologist. Otherwise, they wouldn't have done the revelation. So it was revealed to me that he was disturbed with one of the mental issues, but has recovered and is so religious in taking his drugs. So you can see him and not be able to trust a little bit that he is mentally ill. So he is able to. Are you listening to me? Are you listening to me?
Yes, ma'am. Yes, ma'am. We're all ears.
Okay, it's fine. So the man has his shop where he's a welder. You know, he has his shop where he works, and he has employed many people, and people work and receive their pay. You see? So when your mental health is intact, you are able to function adequately. But when your mental health is derailed, it's malfunctioning, it's maladaptive, then it becomes very difficult for you to function. So okay. So there are some issues that we human beings at times say. Hello? Hello? Hello?
We're hearing you, ma'am.
Okay, it's fine. It's
We're
okay.
hearing you.
It's okay. So there are some behaviors that people put forth that at times we say they are mentally ill. At times we say they are mentally ill when they are not actually, when they don't have mental disorders. So like this one I've put forth here, you can say that we have culturally approved responses to a common stressor or loss, such as death of a loved one, is not a mental disorder. So when people lose their loved ones or they are bereaved, it is not classified as a mental disorder. It is a normal life situation. It is a stressful situation, but that has not gone to mental disorder. And then before you classify a behavior a mental disorder, or you classify or you say someone is mentally ill, we have what is called the Dictionary of Clinical Psychology. That is the DSM-5, where you can make reference to. It guides you, it tells you how you can say, how long a behavior can be exhibited before you can say a behavior is a mental disorder, is a disorder. Now, you cannot just say what someone is doing today, just today, is a disorder. It is only a disorder as prescribed by the DSM-5, that for some behavior, if it happens for a month, for 2 months, for 3 months, then you can start looking at it as a disorder. Now, for a behavior that has been exhibited just in a week's time, if you look at the DSM-5, it will guide you not to say a behavior exhibited, a maladaptive behavior exhibited within a week is not a disorder. So it has that every disorder has a specification. Every disorder has a specification in which you can say confidently that this is a disorder or this is not a disorder. Now, we'll also look at some deviant behavior. Some deviant behavior are, for some people, they classify it as a mental disorder, as a disorder, whereas they are not actually disorders. So in order for us to know that a particular behavior is a disorder, the DSM-5 will help us to understand, giving us a duration, giving us some specifications that if this person behaves in so manner within a specified period, you know, that. And then you look at, let's give an example with depression. We see that depression, when someone is depressed, you cannot categorically say someone is depressed until you see a number of symptoms and then for a number of duration, for so duration. If it is so, then you can confidently say the person has depression. Now, I am emphatically talking about DSM-5 because it is what will guide you. It is what guides us to be able to identify a behavior as a disorder. So when it is not, it is not. So let's look at, we have looked at psychopathology itself, and then we have looked at how some behaviors are not disorders. And I have been able to tell you that reference must be made to DSM-5 in order to make a proper diagnosis for you to know someone has a disorder or not. So let's look at the evolution of psychopathology, how it began and how certain explanations were given as regards mental disorders. So we are told that early explanations, that is, in those days, historically, mental disorders were looked at as something that is supernatural, as something demonic, as something that has to do with the spirits. And so in those days when people were mentally ill, it was looked at as though it's a kind of punishment. They say that God is punishing this person for their sins. And then it could be the spirits from the village that have taken over him, or demons, demons from the river that has occupied him, and all of those. Failing to understand how these disorders emanate, and failing to look at the root of these disorders. So basically, these were explanations given. When someone had a disorder or was mentally ill in those days, it was looked at as something that had to do with demonic possessions, divine punishment, and all of those. Now, there was a time when we were told that one man was sick, was mentally ill, and then traditionally he was beaten such that those evil spirits and demons would get out of him. And so they dealt with him seriously. He had bruises all over his body. He sustained a lot of injuries and all of those. But to the traditionalists, they felt that they were doing their best for that man to get well. And so when they couldn't succeed, someone else who came around informed them that there is a hospital that can take care of this. So they moved that patient to the hospital, and he got well almost immediately. He was given the proper attention, and it didn't delay. His recovery was speedy, and he became well. But that which I explained about the early explanations are the kind of explanations that people gave in those days when they didn't understand what mental disorders mean. So we look at biological tradition. The biological traditions also looks at the brain, the malfunctioning in the brain, and then the genetics. Hello? Hello?
We are hearing you, ma.
We are hearing you, ma.
So biologically, it is believed that mental disorders. Are you asking a question? Are you asking a question? If you want to ask a question, you put up your hand and I will allow you, please. So let's go on with the lecture. So the biological explanation of mental disorders is that mental disorders emanate from the brain. And then it is genetic. How is it that? You know, we have some neurotransmitters that transmit a lot, that help us to work well, that help us in our mood and all of those. We have the serotonin, we have the dopamine. And so now when these neurotransmitters or when these chemicals are not inadequate, they are inadequate and they are not balanced, or will I say there is an imbalance in the supply of these chemicals to your brain. It can lead to a lot of issues. Now, serotonin, lack of serotonin can lead to, or the imbalance of serotonin can lead to depression and anxiety. And also, for the dopamine, an imbalance in it can lead to schizophrenia. So this is another explanation. Before the biological tradition, it was explained that this was supernatural, and as a result of the evil or the bad behavior or God punishing someone. But here is another explanation talking about pathologies in the brain, the malfunctioning of the brain as a causal factor of mental disorder. And then the genetics. Here we have the hereditary explanations. Now, if you know, mental disorder, it is explained biologically, which we have talked about, and then using genetics. Now, if you come from a family that has mental illness, of course, it's going to be a factor for explaining mental disorder. And that is why when people who are mentally ill, or even not only mental illness, but then other physical illnesses, when people go to the hospital, they're asked a lot of questions, all in an attempt to trace the history of the sickness. Now they can ask you, who has this problem in your family? Is anyone with this issue in your family? And then if there's anyone, you tell them yes. They have a point that yes. And they can ask you, what about your grandparents? Was anyone having in your lineage? Was anyone having that? In all of those. And then if you're able to say, yeah, there were some 2 persons who also were befallen by such illnesses, then there is a root to your illness. There is a root to that mental disorder. So under biological explanation, we explain mental disorder based on genetics and based on brain pathologies. Just like we say, there are times, when people who have fallen victims of accident and all of those, and then maybe they had injury in the brain, they had brain injury, and shortly after that, they are forgetful, they can't function particularly. It means that a particular part of the brain has been affected. And so that is why that disorder is coming up. So mental disorder could be explained using also biological traditions. So let's look at the psychological tradition. Under the psychological tradition, there are lots of theories that have tried to explain mental disorders. Some looking at disorders right from the scratch, from the childhood, from your childhood to adulthood, you know. So they are trying to explain that disorder from your childhood experiences to where you are at the moment when you are exhibiting that malfunctioning or that maladaptive behavior. So how is that going to be, or how is that done? First of all, as Sigmund Freud talked about unconscious conflicts that operate within the childhood years. Now, he experienced this conflict himself and was able to propound this theory based on his experience as a child. But if you look at these explanations, you will understand that they are somehow true. They can also explain mental disorders. That's why I say they are somehow true, because there are some theories also that say, no, it is not like this, it is like this. So if we talk about theories, we are not totally saying, yes, this is how it is exactly. But everyone is giving the explanation based on how they perceive it. So this unconscious conflict that Freud talked about, he also talked about learned behaviors that as a child, if you are not given adequate love, what happens to you as a little child? Now, most of you here are parents, isn't it? Hello?
It is. It is.
It is.
Hello? Hello?
Yes,
Hi.
we are hearing you.
Hello?
Hi.
Okay, it's fine. Yeah. Most of you are parents. Internet connection is unstable. Okay. Most of you are parents. Yeah. So, yes. Most of you are parents. Okay. What I'm saying is that most of you are parents, isn't it?
It is.
Most of you are parents, and then most of you were children. All of you were children. All of you were children.
Yes. Yes.
Most of you were parents. What I'm going to talk about now is what is happening, isn't it? So what I'm trying to say is that as a child, when you were children, maybe at some point you felt like mommy didn't love you, daddy didn't love you. How did you feel?
Felt bad.
Felt bad. Yes. And how did you address that? Yes. How did you handle that?
Aggressiveness.
You became aggressive.
You begin to ask questions. Are they really my parents? You begin to ask questions.
Oh, yeah. Yes. Yes. Of course. You ask a lot of questions because you are not sure of what is happening to you. You feel like everything should be okay, isn't it? You feel everything should be normal. And for the fact that you are being maltreated, you feel that you are being maltreated. You feel that you are not shown that love. And so you develop some kind of behavior and you start exhibiting them. For some, they become so aggressive. For some children, they become so aggressive and naughty, so destructive and all of those. But for some, they become withdrawn. For some, they become withdrawn. And so and so it makes them it becomes very difficult for them to graduate from those stages into another stage that is more benefiting. So they move on with this feelings, this behavior, this sadness and all of those, feeling lonely and all of those. They move on with this into adulthood. And once they move into adulthood with this, for some, they become so depressed. They feel like they don't have someone to share their problems with. They don't have one to explain what is going on within them and all of those. So they feel, even the parents that they should be talking to, do not give them attention and do not show them love. So at this point, many of these children meet their peers outside, and they're the ones who take over from the parents. And believe you me, you see a lot of things happening because parents have refused to take up their responsibility. They have refused to understand their children, and so have led them unknowingly into the hands of people in the society. And so a lot of things starts happening. And so when someone has depression and a person comes to the hospital, it is also stress. How was your experience as a child? As a child, when you were growing up, are you able to say a lot of things about your childhood experience? And then when you're able to let these things up, you let everything out of the bottle, you allow people to listen to you and all of us, then they'll be able to help you understand how and why you are behaving that way in the present day. So psychological explanations are given based on learned theories, learned behavior, behavioral conditioning, cognitive processes, and all of those. We have also unconscious conflict. At times, this conflict, like we said, when you're not loved, when you are not happy in the family, and you're having a lot of issues with your parents, you know what goes on within you. Like most of you said that you have conflict. You are sorry, like you were sad, you were aggressive, you asked a lot of questions. These are the unconscious conflicts that came into your mind at the time when you were experiencing such kind of encounters. So with the psychological explanation, mental disorders are explained well and adequately well, and people are able to understand how the cognitive processes operate, whether you are not able to think rightly, where your thoughts, maybe your thoughts are not positive and all of those. Now, when your thoughts are not positive, what is it about you? You're always thinking negative. You feel like when someone hits you, you should hit that person back. You are thinking that, yeah, people don't love you, people hate you, and so for you, you cannot go on with so and so whatever achievement you want to achieve in life, or whatever success you are looking at. So let me give an example here at the moment where we talk about cognitive processes. And there was a time when I was in the hospital with my elder sister, now late, and she was behaving somehow. You know, when I say somehow, I mean she was like about to leave. So it was so scary at the moment. I didn't know what to do, so I ran to the doctors quickly to inform them of the development. So the doctors came immediately. So when they came, they attended to her, and God willing, her health was restored and she was fine again. So there was a woman that was next to us. Her bed was next to us, and then she voiced out this. She said, that if she was the one who called these doctors, they wouldn't come. Then I asked her, why would they not come? She said that she has a bad blood. That's direct translation I'm giving you, that she has bad blood. So I tried to understand what she was trying to talk about. And I asked her that what does she mean by bad blood? That in fact, she is saying this, that every hospital she goes to, no one gives her attention. The doctors don't give her attention. The nurses don't give her attention. This is her perception, you know? And she further said that if she is sick and the sickness requires blood transfusion, it will be very difficult to get someone who will give, donate blood for the transfusion. That I asked why. He said the blood will not be the same with her blood because people don't like her. So I now explained to her that it is not done that way. Even if people don't love you, their blood could match yours. Now we have blood types, and if your blood type matches the other, of course you'll be transfused. So, and her name was they call it Malahium. So that's a negative one. In English, let me try to talk about it, translate it in English. Like Malahium, that's someone who is unlucky. Unlucky. Say, for instance, you give someone a name unlucky. You know, people name people lucky and all of that. So this one is unlucky. So that's the kind of name she had, and this were her experiences. So I had to, in my little way, then I had not done my first degree anyway, but I was able to counsel her, and I gave her the courage to move on with life and not to think negative. And in fact, I encouraged her to change her name from unlucky. She can say lucky. Yeah, and all those will be. And first of all, to correct her thought, I was in a way trying to correct her thought that she should view things positively, and she will see positive things unfolding. She will now see positive things unfolding in her life when she perceives things positively. Now, that's a behavior that is not good enough. She exhibited anyway, but then I was able to put her through in a little way that I understood how positive thinking could help people remodify their behavior. So this understanding the explanation of mental disorders using the historical perspective, and then also understanding the explanation of mental disorders using biological perspective, using psychological perspective, would help in laying a groundwork for therapeutic approaches. So when you understand people in that manner, you'll be able to give a better therapy to help that person come out of that kind of illness or disorder and have a better life. And that improves the well-being of such a person. So with this, we are able to understand excellently how mental behavior comes, or how it starts to come, or it helps us to know how to go away or how to go about handling issues of mental disorders. So we have talked about mental disorders. And one may be asking, do we have anything like mental health? One may be asking if there is mental health. So like people say, mental disorder or mental illness, it's when you have a maladaptive issue, or it is when you are not able to function adequately. So function well, isn't it? When you are able to biologically, psychologically, and culturally, you are able to function adequately. It there shows that you have a good mental health. Hello?
Hi.
Hello?
Hi.
Hi. Okay, that's okay. So when you talk about mental health, it is a label. It is a label. It is a label that covers a lot of perspectives. Yeah, and it is an explanation of how you are well, how you are functioning well. The absence of incapacitating symptoms, the absence of disease. Some could say that the absence of disease and your ability to function adequately means you have your mental health intact and all of those. So let's go back. Okay. So what objectives do psychopathology or does psychopathology have? What is the basic objective of psychopathology? Let me take it away. What is the basic objective of psychopathology? We have been looking at the definition of psychopathology, how we are able to understand psychopathology using the historical perspective, how we are able to understand psychopathology using the psychological perspective and the biological perspective, how we're able to explain mental disorders. Now, what is the objective of psychopathology? Yes, can anyone say? Can anyone say? Are you with me?
Okay, let me try. Good morning, ma'am.
Yeah, can you give us an objective? One objective of psychopathology?
Okay, I will say the objective of psychopathology is to know the cause and effect of certain psychological issues.
Yes. Another one, another explanation?
Yes. Good morning, ma.
Hello, ma.
Good morning, how are you
This
doing?
objective, fine, thank you. My name is Chairman John Ode. I think the objective of the psychopathology is to understudy the disorder in human, to study the disorder in human being to a point where if there are abnormality, the psychopathology is to recommend probably the remedy or the treatment that can help the person function effectively.
Okay. All right. Thank you so much. Yes, someone else
try?
wants to say something. Yes, you can say.
The objectives is to study, to understand or classify abnormal thoughts.
Okay.
And the causes of an individual, the mental and illness of that person.
Okay.
Another trial here, man.
Okay.
One of the other objectives is to describe, predict, explain, or ultimately control abnormal behaviors.
Okay. That's very good. You all know it. So you have been reading your text, isn't it? I mean, you have been reading your textbooks. You have been Googling. You have looked at those things, and then you are beginning to understand them better, isn't it?
It is, man.
Oh, yeah. Like you have said, psychopathology, the study of psychopathology study enables psychopathologists to understand illness situations, just like you have said, to be able to describe. When you understand something, you describe it, you give an explanation, you predict. That's you give, you also diagnose, eh? You talk about treatment modalities as well, and also how you can control that behavior best in order to enhance a well-being, individual well-being. Individual well-being encompasses functioning. Now, functioning, ability to function adequately, and mental illness cannot be separated. If you have mental illness, functioning is maladaptive. You are not able to function adequately. If you have good mental health, then you are able to function adequately. Let's look at this. At times, you may be at office and then you find out that you have a lot of tasks to carry out. A lot of files lie on your desk, and that are given timelines. You need to complete in a specific timeline. And you realize that you have other issues, other engagements as well to handle. And then you ask yourself, is it only me to do all this? And you are already stressed up. You're already stressed up. And at the moment you are stressed up, you may commit a lot of blunders. You may commit a lot of mistakes. You may sign wrongly. You may not even read a document that you ought to read to understand before signing. And that is where a lot of mistakes can come in. That you signed a document and that can be used against you. Don't you think so? So functioning, it's a key thing in this course, because we are looking at how this behavior, this maladaptive behavior, can affect patients or affect people who are behaving maladaptively, or how, when this is improved, or when it is treated, or when these patients are helped, how they can behave better, how they can function better. So there are also
excuse me, ma.
Yeah.
Just like the example you just gave now, in the office setting, could one be right if things like that happen? Then probably you see some people at that point, even when you want to go to talk to them, they become unnecessarily angry just because of what is before them at that particular time. Could that be? Can one classify such a person as a mental disorder, or how did you classify such people at that particular time?
No, you cannot classify it as a mental disorder, because maybe you are experiencing it for the first time. I remember I told you that we make reference to DSM-5, and DSM-5 stipulates the number of times that one will exhibit a particular behavior before it can be authentically said it is a disorder. So when you meet someone in the office misbehaving, it doesn't give you the right to say the person has a disorder. But these are issues. It may be a symptom of what is disturbing the person. If you want to know whether it's a disorder or not, you have to observe that person for some time, as stipulated as stipulated in the DSM-5. I don't know if I've answered
yes,
you.
ma, it could be a sign of frustration to an extent, not really mentally problem. It could be as a result of frustration. The person might behave that way.
Yes, it could be as a sign of frustration. It could also be maybe a mental disorder trying to show up. But because you are seeing that person for the first time, you have no right to classify that until you observe that kind of behavior for some duration or for some time, as guided by the DSM-5. Now, if you come to my office today and you see me in that mood, you see me in that mood, and then you say I have a mental disorder, then you are wrong. If you want to tag me with that, then you have to observe me for the certain number of times that DSM-5 stipulates. Maybe 2 weeks, maybe 6 months, maybe 4 months, and all of those. But if you see me exhibiting that just a day, or not as DSM-5 has stipulated, then you cannot classify it as a disorder. It is an abnormal behavior, actually, because in a workplace, people are not supposed to be aggressive. Do you understand me? Hello?
Yes, ma'am.
Yes, ma'am, we understand you.
Yeah. People are not supposed to behave abnormally. In a work setting, people are supposed to be well behaved and all of those. You're not supposed to be aggressive to people, because if everyone decides to be aggressive, then imagine how the workplace will look like. People will start running away, isn't it?
It is, ma'am.
So I don't know if I've answered you.
Yes, you are. Thank you,
Are
ma'am.
you sure? Are you sure?
Yes. I'm very sure, ma'am. Thank you.
Hello, ma'am.
Okay. Yes?
I have a question.
Yes.
I have a question, ma'am.
Okay.
But I'm a little bit confused and I need more light on this. This mental health is start from birth or after birth? That is from the womb or after birth?
You see, we were trying to give explanations to mental disorders, isn't it? We just concluded. Let me take you back to that slide. Are you here with me?
Yes, ma'am.
Okay. Can you see the explanations?
Yes, ma'am.
Okay. So for some, mental disorder is coming as a result of forces such as demonic possession, divine punishment. Then for some, biologically, it is genetic, or it is a brain malfunctioning, or a brain malfunction, or a brain pathology. Now, that question you have asked, some have mental disorders that have origin from genetics. That is hereditary.
Yes.
Yeah. You understand what I'm saying?
Yes,
You're
ma'am.
asking if someone can be born with mental illness. Yes, with this explanation, we can say yes, someone can be born with mental illness, but then this is not all mental illness come as a result of this. Do you understand the logic?
Yes, ma'am.
Not all mental disorders come as a result of biological traditional biological explanations. There are some mental disorders that come as a result of brain pathologies, which can be resulting from accident and all of those. Now, when someone has an accident and the accident affects the brain, was the accident from birth?
No, ma'am.
Okay. So have I answered you?
Yes, ma'am.
Okay.
Thank you, ma'am.
Thank you.
With the example you have given, I understand that one of my friends had an accident, and from that, after the accident, in everything he talks too much, and every topic of discussion he always wants to talk, and he will always want the floor to be only him to be talking. So even we decide that the accident touched his brain small.
Okay. Okay. Is that a report from the hospital?
Yeah, no, but it's from our own studying him for the year.
Okay, he was not like that initially.
Yes, ma'am.
Okay.
It was not like that.
Okay, it's okay then. Yes. So now we are also look.
Hello,
yes?
ma. Sorry, ma. Okay. This mental disorder, is it the mental disorder that leads to madness?
Is it what?
The mental disorder that leads to madness.
All right, we don't say madness. We don't call it madness, because when you call madness, it is too cruel and raw. So you call it mental illness. Is that okay?
Yes, ma'am.
You call it mental illness, and this is what we are talking about. Hello?
Hi, ma'am.
We're talking about mental illness. We're talking about mental health. We're talking about systematic study of mental disorders. Now, when we were talking about what's it called? When we're looking at a systematic study of mental disorders from the earlier slides, I did mention, specifically in the biological explanations, I did mention something of imbalances in the body chemicals and the chemicals in the brain. So now for people who are schizophrenic. And that chemical, particular chemical, is called dopamine. I don't know if I'm answering you, or I've answered you.
Yes, ma'am.
Have I answered you?
Yes,
You
ma'am.
can ask your question again.
Yes, ma'am.
You can ask your question again.
Ma'am, satisfied, ma'am.
Okay, it's fine. Okay. Okay. So we're looking at the different views about psychopathology. Already we have at least hint on all of this. It is looked at as statistical statistical deviation from the normal. It can be looked as maladaptive behavior, as distress and disability, social deviance, discontrol or deregulation, harmful dysfunction. Now, for some mental disorders, people can injure others and can even harm themselves. Now, there was a time when there was one patient that we were handling, and anyway, let me leave that one. There was another patient that was being handled by someone else, and the person narrated the story to me that that patient was vibrant. That patient was aggressive. The patient was violent. So the patient came and was highly agitated, was not stable. Battery is running. Was not stable, and we're going to rush. We're going to rush. We have power problem here, and the laptop is going down. So, but we shall continue. So what we did was, what he told me was that the mother, who is a caregiver, was sitting and lying down and waiting for the patient to come back from where the patient went to. To her, she felt like the situation was not so serious. So, but the patient was indeed very sick. So the patient was coming back and came and held her by the neck region and was trying to strangulate her. So the nurse that saw this rushed quickly to help out in the situation. And when he arrived, this patient now injured the nurse. But the nurse didn't stop until he rescued the mother from the strangulation. So there are a lot of these issues like this that come as a result of illnesses that befall some individuals. So when you are having imbalances in the chemical and the body chemical or the brain chemical, or you are having imbalances in the neurotransmitters, it is obvious that you will display some kind of behavior that is unstable, some behavior that's aggressive, and all of those. So when you see someone behaving aggressively and all of those, you need to dig deep before you can now conclude the person has such a behavior. So statistical psychopathology as statistical deviance. Now, this is a commonly used term, and with common sense, pathology has to do with psychological phenomena like abnormality or normality. Now, when something it's pathological, it's a disease already, it is considered abnormal. So when it is when it has deviated from the normal, when it has deviated from the normal, and you know the norm, people know what is ideal behavior, and people know what is not ideal behavior. So when people have deviated from that which is supposed to be a recognized way of life of a society that has been documented, then it becomes abnormal and it becomes pathological. Hello? Hello?
Hi, we're here.
We are with you, ma.
There are other explanations as well. Now, to most people, psychopathology and mental disorder. To most people, psychopathology and mental disorder refers to behaviors or experiences that are infrequent, e.g., paranoid delusions and hearing voices. Now, when you start to hear voices, we start to have paranoid delusions, then it is an indication that that behavior which you are exhibiting, it's not normal. It's not normal. Hello? Hello? Hello?
Hi.
We're all ears. Continue, ma. We're with you. Continue.
We're in a lecture and I can hear someone still there now.
I wonder.
That's not proper. That's not proper. Let's be civic. Let's be civic. Okay. So we will be resuming. Yeah, my battery is down already. We'll be resuming again at 1 to 2. I mean, 1 to 2. 1 to 2, man. 1 to 2. So my battery is down. Let me charge and then we'll continue from there. Is that okay? So my battery is down. Let me charge and then yes. Shall continue from.
Okay.
Thank you so much. Yes.
Thank you, ma.
Thank you. My battery is down completely. 5%. It's not good.
Who is that person making noise now? For heaven's sake.
Wonder, we can't behave mature. I don't understand how we do behave in this class.
Mata tongo abina nongo. Mata. Anytime you unmute your phone, you discover that the lecturer is from her side is echo. And you can't be in the class and continue to do you in particular, you've always been doing that. Please always try to, if you're not talking, to mute your mic. You don't expect class rep to reach out to everybody at all time so that he will not even be listening to a lecture. Is that what people want him to do? Is that what people want him to do? We are all mature here. It's not nice at all. It's not nice at all. We
Every day,
I
think the same story.
Whoever that is Mata Tongo should be
Mata, please. Mata, please.
Because
if you are hearing me, please.
She has left mic on mute all through, and it's making a lot of noise.
On mute all through, you disturb class.
So how can you
not just today, almost every day.
Saying you don't know. How you know?
I don't know now.
So Mata Tongo, try to be checking your mic, please. If it is on mute, you mute it.
Okay.
Class rep, if you are still here, please. I want to find out about the lecture. Okay, about the lecture yesterday. If the class rep is still here, they find out about the lecture yesterday. When are we having the notes so that we can be going through the note, please? And then probably if there is a way we can reschedule again, have we been able to discuss that with the lecturer? Thank you.
Mr. John, good morning. Sorry, I'm not a class rep, but I think let us revert to our listing to discuss very important things of this nature, because they are still recorded.
Sorry about that. Thank you.
Mata. Don't unmute your mic. It's your electronic device that is causing that, the phone or the tablet you're using. It is the one that is causing that. So the only thing you can do is that always mute your mic, because when you on the mic, the system is interfering with each of everybody's on the Zoom. So that's just it. So always mute it. If you want to talk, yeah, you talk sharp and you mute it back, please. And as they say, John, as Manasseh said, every discussion that we have to discuss concerning we students, let's go to our group, not here. This Zoom is always recorded by the ICT that will be presented to IPES, the people that are sponsoring this program. So they cannot be hearing our discussions. It's only the lecturer that will be teaching us here. Please, let's be mindful of this.
Thank you.
Now I'm logging everybody out. We are going for the break. I'm the one that is the host.